Can a stroke present with only facial symptoms? In conclusion, yes, it is possible. Now, let's try a facial nerve test right away. Hello, this is YouTube Medical University. Today I will introduce 4 key features of strokes that you absolutely should not overlook. Even the famous Giants manager Nagashima suffered a stroke. Actually, there is a critical treatment window of 4.5 hours for strokes. If you can get treatment within 4.5 hours, you can use medication to dissolve the blood clot, which greatly increases the chances of recovering from a stroke without any after effects. And recently there is also catheter treatment. A treatment has also been developed where a wire is inserted through the blood vessels to directly remove the blood clot causing the stroke. It is said that the sooner this treatment is performed, the less likely there will be any after effects. So if detection is delayed, the chances of lasting after effects are higher. The initial symptoms of a stroke are not always as dramatic as you see in TV dramas. Suddenly, one arm and one leg can't move. If the symptoms were that obvious, it would be good, but sometimes you might think, huh? Is this kind of symptom in the mouth really a stroke? Can just feeling dizzy be a stroke? I thought having trouble speaking was just because of age, but it might actually be a stroke. We've gathered some unexpected symptoms like that. To give you the conclusion first, if you suddenly experience symptoms like the ones I'll introduce today, especially if they appear on one side of your body, that's a sign that something is wrong. If you ever feel that way, don't hesitate to call an ambulance. As I mentioned earlier, with a stroke, the time from onset to treatment is extremely important. If you call an ambulance and the paramedics think it might be a stroke, in most cases, they'll take you to a hospital that can provide the necessary treatment for a stroke. When I'm actually seeing patients, I often wonder why they didn't come in sooner. I often think if they had come in just one day earlier, we could have started treatment and the after effects might have been much milder. And now, please take a look at this. The reasons why we may need nursing care or assistance in our daily lives in the future. Surprisingly, the second most common cause is stroke, including cerebral infarction. If you have a cerebral infarction, you may no longer be able to freely enjoy things you used to love, like traveling or shopping, or the life you had imagined. You might not be able to spend your ideal retirement the way you imagined. By watching this video, you'll increase your chances of living a vibrant life in the latter half of your years, so please watch until the end. 4 dangerous symptoms of cerebral infarction you shouldn't miss. The first is numbness in your hands or mouth. When it comes to cerebral infarction, it's well known that you can suddenly lose strength. If you suddenly can't walk, you probably won't hesitate to call an ambulance. However, sometimes you can still move, but it feels oddly numb, like there's a layer over your skin, or you feel numbness or tingling. Those kinds of symptoms might be early signs of a stroke, especially if the numbness is on one side rather than both. That's a characteristic symptom. Even so, you might just feel some numbness in your hand and think it doesn't seem like a serious illness, so you decide to wait and see. I think a lot of people feel that way, right? Of course, numbness in the hands can also be caused by illnesses like diabetes, alcohol-related disorders, or menopause. It's not always a stroke. Since these symptoms can be hard to notice, one way to check is, for example, to hold a cold drink in your right hand and left hand. Try touching it with each hand and see if there's any difference in how it feels. Also, a symptom that is characteristic of a stroke is numbness around the mouth. If you've ever had anesthesia at the dentist, you probably know what this numbness around the mouth feels like. It can feel like your lips are thick or swollen, or like they're under anesthesia. These kinds of symptoms are characteristic of a stroke, so why is numbness in the hands or mouth so typical? It's interesting when you think about the anatomy of the brain. Please take a look at this image. On the right side is the front part of the frontal lobe, and on the left side is the back part of the occipital lobe. Right in the middle, there are red and blue lines. The blue area of the brain is responsible for the sensations throughout our body, like numbness, touch, and the feeling of hot or cold. This area controls those sensations, and this next image shows a cross-section of that blue area. It might look a bit eerie, but what this means is that each part of the blue area in the previous image corresponds to sensations in specific parts of the skin on our body. This picture here represents that. Right around the middle part of the head, there's a drawing of a large hand, and below that, isn't there a drawing of a face? And especially the lips on the face are highlighted. Aren't they really big? That's right, the mouth is packed with nerves. For example, if you have a grain of sand on your foot, you probably don't notice it much. But if you get a grain of sand in your mouth, it feels really uncomfortable, right? That's because, just like in this image, there are a lot of sensory nerves in the mouth. And if you look at this image, the hand area, it's really big, isn't it? Humans evolved from walking on 4 legs to walking on 2. We became able to use tools with our hands. In order to use our hands skillfully, there are also a lot of nerves spread throughout the hands. That's why when a stroke causes brain damage, it's said that problems with the hands and mouth are more likely to occur because these areas take up a large portion of the brain. Also, since these senses are very sensitive, even a little numbness is easy to notice as a symptom. What do you think? Isn't it interesting to think about why these symptoms occur? If you overlook them, it can be dangerous. Here is the second of the 4 dangerous stroke symptoms. Facial drooping. Is it possible to have a stroke with only facial symptoms? The answer is yes. Let's do a quick facial nerve test right away. Let's try it. Everyone, feel free to join in. First, close your eyes tightly to form wrinkles. Then, lift the corners of your mouth in a smile to crease them too. And finally, stick your tongue straight out. Try these and check if there's any difference between the left and right sides. When someone with an actual disorder does these tests, for example, they might only be able to raise one side of their mouth while the other side droops down. They can tightly close one eye, but the other eye can only close lightly. Look closely and you'll see the muscles on one side of their face aren't working properly. There may be no wrinkles at all on that side. These kinds of symptoms could be the initial signs of a stroke. A man in his 70s that I treated had a caregiver, his daughter, who noticed that starting from breakfast, her father began dropping food from his mouth and spilling drinks. When she told me that, I examined him and noticed that one side of his mouth had no strength at all. What this symptom indicates is the function of the facial nerve, which controls the movement of our face. So if there is a difference between the left and right sides in the test I just mentioned, there is a high possibility that the facial nerve is impaired. Of course, the facial nerve can also be impaired by things other than a stroke, such as shingles, so it's not limited to strokes. However, in any case, if these symptoms appear suddenly, please consider going to the hospital. There may be an underlying condition. Let's do a quick review up to this point. First, I introduced numbness in the hands or mouth. The part of the brain that controls sensation has a lot of nerves for the hands and mouth, right? So when you have a stroke, these symptoms are more likely to appear. It can feel like there's a thin layer of skin stretched over your hand, or like you're wearing gloves, or your lips may feel thick and puffy. Even just those symptoms could mean you have a stroke, and the second symptom is facial distortion. When the facial nerves are affected, you might not be able to tightly close your eyes, make an E shape with your mouth, or stick your tongue out. One side of your face might not have any wrinkles. You might spill drinks when trying to drink. These symptoms could possibly mean it could be a stroke. Now, here's the third of 4 dangerous stroke symptoms you shouldn't overlook: having trouble speaking. Other YouTube Medical University channels haven't really explained this in their videos, but there are mainly 2 reasons why you might have trouble speaking. The first is the symptom I mentioned earlier, where damage to the facial nerve makes it hard to articulate words. Let's try it together now. Try repeating the words pataka, 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 pataka. If you end up saying something like anaka, anaka instead, if you can't say it clearly, you should suspect a stroke. Of course, if you originally have poor articulation and there's no change from before, you don't need to suspect a stroke. But if you suddenly can't speak clearly, or your speech sounds slurred like you're drunk, the other person can't understand what I'm saying as well as usual. And for family members as well, if your father, mother, or a relative suddenly can't speak clearly even though they haven't been drinking, those kinds of symptoms could be a sign of a stroke. As I mentioned at the beginning, with a stroke, time is critical after the onset. Please check for any of the other symptoms I introduced today, and if you notice even the slightest abnormality, please consider going to the hospital. And another pattern is when a stroke occurs in the part of the brain that controls language and speech. As for what kind of symptoms appear, well, as I mentioned, sometimes you can't recall the names of things at all. In your mind, you want to say, "Can you hand me the remote over there?" But you can't recall the word remote. You think, "What was it called again?" These kinds of symptoms appear. So, you end up giving instructions using words like or oh, and you start to wonder if it's become harder to find the right words lately. Maybe it's an early symptom of dementia. Many people just leave it alone thinking that way, but if the difficulty with words comes on suddenly rather than gradually like dementia, the possibility of a stroke increases. And when a stroke occurs in the part of the brain that controls language, another distinctive symptom appears. That symptom is suddenly being unable to understand language. For example, if someone asks, "How are you feeling?" If a stroke occurs there, sometimes completely incoherent, but somehow fluent words come out, like saying, "I want to drink meat," even though they can't understand the meaning of what the other person is saying at all. If the part of the brain that produces speech isn't damaged, they can't grasp the meaning, but only say things like, "I want to drink meat," or "hit the remote." Just these incoherent words come out. That kind of thing can happen. The reason is, when the part of the brain that understands the meaning of words is damaged, incoherent words can come out. When the brain speech center is damaged, you can grasp meaning but can't form words, often saying or that. Thinking of it this way makes it easier to understand. I'll say it again, but you might think, maybe it's dementia. What's been going on lately? You need to be careful not to misunderstand it that way. Here are 4 dangerous symptoms of stroke that you shouldn't overlook. The 4th one is dizziness or unsteadiness. Lately, you might feel dizzy or unsteady. Haven't we all experienced those symptoms at some point? When you feel dizzy, you might suspect an ear problem and decide to go to an ENT doctor. But then the ENT says there's nothing wrong. But it turned out to actually be a stroke. I've seen people like that. In fact, even with a stroke, you can experience dizziness or nausea. Why does that happen? It's interesting to consider the reasons, and you won't forget them. Please take a look at this image. On the right side here is the back of the head, which is the occipital lobe. And at the lower part of the occipital lobe, there is a part called the cerebellum, a kind of little brain. It's the part circled in red. The cerebellum is a very important organ that controls our sense of balance in daily life, as well as our ability to coordinate body movements when we move or pick up objects. So, if a stroke occurs in this area, your sense of balance can be disrupted, making you feel unsteady or wobbly, and you might not be able to walk properly, staggering as if you were drunk. Those kinds of symptoms can appear. Of course, as I mentioned earlier, the most common cause of dizziness is an ear, nose, or throat disorder, and when we talk about dizziness, you may go to the doctor, but it turns out your blood pressure was low, or you were anemic. That can happen too. However, the most important thing we must not overlook is the possibility that it could be a stroke. What are the characteristics of dizziness caused by a stroke? For example, your vision spins around. Actually, spinning dizziness is more often related to ENT issues than to a stroke. But if you feel lightheaded or unsteady and those symptoms persist, the likelihood of a stroke increases. Let me introduce a simple examination to check the function of the cerebellum. Please try it yourself as well. This test is commonly known as the Twinkle Twinkle Little Star test. Hold out both hands and move them quickly like this. If you can't move them quickly and one side moves slowly like this, that's a sign to watch for. Those symptoms suggest a higher chance of problems such as a stroke affecting the cerebellum. However, age and other factors can also cause slower movement in some people. If that's the case, it might not be a problem, but if the symptoms come on suddenly or only one side doesn't move well, the possibility of a stroke goes up. Try it yourself and have your family try too. Let's review. First, I mentioned numbness in the mouth or hands. Your lips might feel swollen or anesthetized. It could feel like a thin layer of skin is stretched over your hand, or your hand feels tingly and numb. If those kinds of symptoms appear suddenly and only on one side, they might be signs of a cerebral infarction. Second is facial drooping. Only one side of the face may droop, with the corner of the eye and the cheek sagging. In such cases, you should suspect a problem with the facial nerves. Make an E shape with your mouth, tightly close your eyes, or stick out your tongue, then look in the mirror to see if the left and right sides differ. Use this to test yourself. The third symptom is slurred speech or being unable to speak. Try saying pataka, pataka. If you suddenly can't say these words clearly, or if your speech becomes slurred like you're drunk. Also, there are other symptoms, like suddenly understanding the meaning of words but being unable to say them, or being able to speak but not understanding what others are saying at all, or saying unrelated words like, "I want to drink meat." Those kinds of symptoms might also be signs of a stroke. And the fourth one, dizziness, unsteadiness, and nausea. Dizziness and nausea these symptoms are common with things other than stroke, but sometimes they actually turn out to be a stroke. Feeling dizzy and unsteady, or walking as if you're drunk and not being able to walk properly. If you can't perform the Twinkle Twinkle Little Star test well, it could indicate a problem with the cerebellum. Please consider seeing a doctor if you experience these symptoms. And while it's important to notice the signs of a stroke early, what's even more important is to be well prepared before a stroke happens. The main cause of stroke is arteriosclerosis, and when we talk about arteriosclerosis, high blood pressure, diabetes, and cholesterol are the major contributing factors. At YouTube Medical University, we introduce important dietary methods and lifestyle habits to prevent these diseases so you can live a vibrant life in the second half of your life. If you're interested, please check it out from the description below. I think many of you watching this video are highly health conscious, or have experienced a stroke yourselves, or have family members who have. On YouTube, various healthcare professionals and ordinary people share information, but some of it can be misleading or even incorrect. At YouTube Medical University, as a doctor, I take responsibility to. I also explain in detail and in an easy to understand way why such symptoms occur and what you should do about them. I would be happy if we could learn together so that you don't end up regretting believing incorrect information. In the comment section, please share your experiences with stroke. If your family has had these symptoms or difficult experiences, please feel free to share. Also, whether you give this video a thumbs up or a thumbs down, your feedback will help us improve in the future. And I would really appreciate it if you could tap the subscribe button so you don't miss the next video. Well then, see you in the next video.